So in this section, we're going to be talking about a series of poses that really requires a lot of hip and lower body flexibility. These postures include splits in different orientations, splits on the floor, standing splits, bird of paradise, which has some of that splits element in it, compass pose. These are postures that require really large ranges of motion in the hips. An important thing to understand is that you have your own personal limits in your hips, just like you do in your shoulders and in your spine in every direction. And those limits are going to be what restrict you temporarily and then ultimately in these poses. And also I want to say that the hips and the lower back are a strongly fasciaed area. There's a lot of strong connective tissue on the pelvis itself and around the lower back area and around the hip sockets. These are somewhat pliable tissues, but they respond best over long periods of time with small doses of stretch to create more length and strength. I'm going to put up a clip of the connective tissue area and the fascia surrounding the lower body. A lot of that white stuff is fascia. If you are going into a pose like splits, and I'll use the Barbie doll again as a model. Let's say you are in the splits like this, but there's still some space. There's still space between you and the floor. Not that that's a big deal, but if you wanted to explore, if you could come down lower, you would have to ask yourself what you were feeling in both hips, whether it's tension or whether it's compression. If she was feeling compression in Hanumanasana, in splits, in the back leg, she would feel it in the back where her leg is going behind her. She would feel like a pinching somewhere like inside the glute area. And then in the front leg, which is in flexion, she would feel a pinching in the front because that's where the leg is going. That would tell her that she can't do any more than this, at least in this exact way, pure extension and pure flexion. But if she doesn't feel that, if she just feels stretching in the hamstrings of the front leg and the hip flexors and the psoas of the back leg, then she might be able to go further. But if that is the case and she can go further than this, it's probably not going to happen in a couple days that she can go down that far. It's probably going to take longer than that. She's probably going to have to come back into her version of the splits repeatedly for short durations to slowly train her fascia to be organized more in this direction, to make it easier for her to go lower and also to free up the muscle fibers so that she can find her ultimate end range of flexion and extension in splits. If you want to find your ultimate range but do it safely, understanding that fascia is made of not just these stretchy substances but also very strong substances that kind of shift and turn in the direction that you generally move over time, then it's going to take a little time. It can take anywhere from 6 months to 12 months to make a really long lasting change in a strongly fasciaed area. As you continue practicing a pose like the splits, for example, you are sending mechanical signals to your muscles and to the fascia, and new collagen is going to be put down, laid down, and it is laid down just in a jumbly pattern, and then your movements train those collagen fibers where to go. And so you want to do that slowly, and then as you continue exploring these postures and the stages of these postures, as they start to open up for you, your compressive limits will start to arise. Then you can know that you have succeeded in at least moving into your ultimate range of motion in that direction. A lot of these poses that we're going to talk about really focus on the flexion and extension movements of the hips. And then some of them do require some rotation, usually external rotation of the hip. And those are all movements of the femur bones, your actual leg bones in the hip socket itself. So the tension and compression is going to be mainly in this area. So in flexion, for example, the femur comes forward this way, and eventually it's going to bonk into the pelvis, or the tissue here of your quadriceps is going to get actually pinched in here, and that's compression too. And you're done, unless you maybe externally rotate the leg or take it out to the side. Same thing with rotation, and a lot of these ask for external rotation or opening your knee and your foot out away from you. Same thing there. You're going to have your compressive limit eventually. And as you can see, as I roll this femur back towards the back of this skeleton, eventually it cannot go any further because it's at compression. And everyone is individual. The hip socket can be more shallow, so someone might have a lot more movement because their hip socket, like the crater in here itself, is actually not as deep. Some people have a thicker hip socket and the lip of it is sticking out more, and so they would have a more limited range of motion. And then this socket, this hole, can even be up higher, it can be lower, it can be more towards the back, it can be more towards the front. And that's going to make certain movements easier or more difficult depending on where it is. And we can't know exactly where your hip socket is or how shallow or deep it is. We have to feel. We have to use our mind and our inner senses to really sense what's going on, because only we can feel the bony contours of our own joints. A teacher can't see that. That's why this tension and compression idea is so important and so empowering for you in your practice. That's just talking about the actual hip socket proper too. Some of these poses, like splits again, your pelvis itself is going to have to move, probably, and your pelvis is attached to your spine. And so you're going to have certain ranges of motion that come into play in your spine too. So you can tuck your hips underneath you, you can tilt your pelvis forward like this, and you can also laterally tilt, which is actually tilting the spine, and you can rotate your pelvis, which is actually rotating the spine itself. When we're doing splits again, for example, one leg is going to be in flexion, one leg is going to be in extension. Some people will be able to keep their hips completely parallel towards the front. Maybe they have that 180 degrees available in their joints that they don't have to do anything with their hips. But in some other people, if the extension is really limited back here, they might tip the hips forward to get more range. So they might have more of a back bend going on. And then we'd have to talk about tension and compression in the spine. And the ultimate limit of you being able to tip your hips forward like that comes from the spine. And then sometimes the hips rotate as well. Oftentimes when you're done, being able to do as much of this as you can do and as much of that as you can do. And if you need more movement, a lot of times the body tries to get it from the hip tilts and the hip rotations. And then a lot of these poses ask for a combination of these. So it's helpful to start out with just something more simple where there's less joint movements going on, which is why we're going to start with splits, because it's really just like you have to have the flexion and extension. And then we observe what our hips and what our legs do and what our spine does to try to accomplish that. And then we add more things. We add abduction, taking the leg out to the side. We add rotation of the leg. Like the Barbie doll, for example, she's trying to do compass pose. This is as much as she can do. Compass pose, as we're going to go over in the breakdown section, the one leg that's coming up is in flexion, which would be just that, but it's also externally rotated so it can stick out to the side. And if she could do it, this hand would be holding this foot, which she can't do because she cannot abduct anymore. She can't take her leg out to the side anymore. And that could happen to you too. You might feel like, oh, I feel a lot of pinching here on the outside. You know that's compression now. That's where your leg's trying to go, and you feel a pinch in that same direction. Well, then to get her foot, if she could do it, if she wasn't made of plastic, and if her spine could bend more, she would have to side bend to hold on to that foot sticking up there. So not only do we have multiple joint movements going on in the hips, but we also might have a side bend going on in the spine. And then compass adds even a rotational element in the spine. So you'd actually be rotating to the right here. These are complex movements, and it's worth exploring your own body, these individual movements one at a time. So we're going to move into the breakdowns now, starting with splits. And in all of these, treat them as a kind exploration for your body. Treat them as a way to explore your particular range, your current range of motion now in the lower body.